Hey guys, and welcome back to the videos. If you are new here, my name is Caitlin, and this is Caitlin and Family, even though so far you guys have only met me. I recently was diagnosed with borderline personality disorder, and I've really been struggling with that. And I noticed when I started looking things up about borderline personality disorder, I wasn't really finding anybody that had young children, and that was a parent. And when you start looking things up about parents with borderline personality disorder, it really only yielded things for children that grew up suffering with parents that were borderline. So I wanted to really kind of create a community that I found was missing, and that is parents of being borderline and struggling. And it's okay to talk about it, and I want to remove that stigma that you have to be this perfect parent, because the truth of the matter is our kids do suffer because of this diagnosis, and that's a real thing, and that's heavy. Honestly, that's really heavy when I think about that. And it's already happening, and my child's only 2 years old. So I had a baby boy. His name is Chase Michael Szymanski, and gosh, he is the light of our world. Just truly, he was just such a blessing. He was definitely a surprise. Me and my husband were not married at the time, but we had been together for 4 years. And we took Plan B to be extra careful, and I ended up becoming pregnant anyways. And that's okay. Everything ended up working out, and we have Chase, and we love him so much, and he's just amazing. But he does have a couple of, things going on. So when Chase was born, he had colic until he was 6 to 8 months year range. And then he kind of grew out of that. And then I started just kind of noticing he was a little bit different than kids his age, in a sense that he was far more hyper, far more dangerous and risk taking. I, at one point in time, wanted to get this kid a helmet because, I know that little toddlers smash their head, but my kid would actually attempt to do a backflip. So he would stand up straight and just jump like that and land on his head, and I'd watch his neck and just, I'm something's different here, So I ended up talking at his 18-month appointment with the doctor, and we did the little surveys that they give you to fill out, and a couple of red flags came about on the surveys, and she recommended that I get him evaluated by early intervention, and so I did. And early intervention is free through the state of Illinois, at least that's where I reside. And it came out that he was 38% delayed with his speech, with his development, and they actually also threw on occupational therapy because they said that he was sensory seeking, and he is proprioception sensory seeking, and he has not been diagnosed with ADHD or autism or anything like that, but I am a nurse, and from my observations, it is something that I am monitoring. Okay, monitoring. I am not saying my kid has this, but I am seeing signs that he may develop this. So, he can never play with one thing. It's boom, 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 constantly. It does not stop. And that's where he really, really needed that OT, because he couldn't regulate himself to be still, even if that meant for 3 minutes. So, and it's interesting when I talk with my own therapist about it, because he is observing a mom who has manic episodes. I'm a month deep in being manic right now. Getting up at 4 o'clock in the morning, 3 o'clock in the morning for the day, working on all these different projects, my wonderful patio furniture set here. You guys, like, he's watching that. No wonder he's, mom is. So that's heavy. Oh gosh, it sits with me deep on my heart. Because we never want to mess our kids up. And that is something that I remind myself of. I would never intentionally cause my child any physical or emotional harm. This is what I mean, guys. This stuff is like, it's heavy when you have BPD. It's heavy, you suffer a lot. Think about things. OCD constantly is just, So I tell myself I would never intentionally do that to him, But it's something that has happened. And so here we are. And now we have to deal with it. We've recognized it, and we got to get him the help. And we got to get mom the help, him the help, and also dad the help. So that's another video that I've been asked to make, is how BPD has affected my marriage and my husband, and like our relationship. And actually even his relationship with Chase, because Chase kind of has the same issues that I'm having going on. So it's like a double whammy for him. So I'm going to make a video about that, but this is just one subject at a time, you guys. It's a little heavy. So anyways, he can't sit. So that's something that we've been working on. And it's been going really, really well. He's been in early intervention now for about 6 months, and he has far caught up. He has past caught up. It's amazing. Absolutely amazing. His speech, his sensory seeking, he can now identify his own needs, and like if he knows that he needs to go push something, he will go out there and grab his wagon and be like, "Mama, walk." And I'm like, "All right, let's do it." So he's now able to communicate to me what he needs, and that is so helpful. It minimizes the frustration for me and for him, and we are doing better. So thank goodness for that. The other thing that he has is emotional dysregulation. And that's another thing that I talked about with my therapist, because it just breaks my heart that I'm emotionally dysregulated, and I'm sure that I have now caused him to have emotional dysregulation. And so it's really interesting because I cannot identify my own emotions because I disassociate. So I cannot identify my own emotions, but I'm trying to teach my son how to identify his emotions. So, it's a journey. It's a journey. But with all of that going on, I also wanted to talk about a couple of other things that are going on as to why I'm struggling so much. And I know there are other people out there that are struggling in the same exact way, and they might even be single moms and have no help at all. So, shout out to all the parents out there, single dads, just all the parents out there trying to get it done in this world and struggling mentally, I'm a college student. I know I'm already a nurse. I have an associate's degree in nursing. I've been working as a nurse now for 3 years as an oncology inpatient nurse at a level 1 hospital. So we get the very critically ill patients. and I was full-time, which was 3 days a week, and I work an hour away. So my days with 2-hour travel time are like 15 to 16 hours long. And that was 3 days a week for me, sometimes 3 days in a row. So I cut back to part-time, and now I work only the weekends, but that's also stressful because my husband is off on weekends. So I work the weekend and he's off on weekend. So we have opposite schedules going on. And then I'm home Monday through Friday with Chase. So that is stressful. My husband goes out of town, like right now he's out of town for work. He installs tornado sirens in Illinois, Indiana, and Wisconsin. So that's stressful, worrying about him at installs when he's like 80 feet in the air, or probably higher. I don't even know. I just pulled a number from my, backside. So that can be stressful. I'm in school for my bachelor's or whatever. That's what I'm going back for. I have like 4 more classes to complete of that. I'll graduate in October of 2024. And so yeah, it's just, it's a lot. It's a lot, my father-in-law just passed away at Christmas. So we've been dealing with lots of ups and downs. My BPD diagnosis is new. I was also diagnosed with complex PTSD, OCD, generalized anxiety, and depression. And sometimes I can't really figure out which one is the driving force of what behavior. And that can be really difficult because I feel like they all kind of require some different skills to manage them. So, with it all being a new diagnosis, I don't have any skills yet to manage. So life has just been really, really, really stressful. And I'm trying to be a parent, and I have a 2-year-old, and I'm dealing with 2-year-old tantrums and the terrible twos, and it's stressful. I'm stressed, and my BPD comes out in rage. And so, I don't have quiet BPD. I'm like, oh my God, why is this happening right now? That is what is coming out. And I'm looking at my husband and I'm like, I need you to take over. I don't know what's going on. I need help. Somebody help me. And so it's overwhelming for the family. Okay. I'm being really vulnerable right now talking about all of this, but that is what happens. And especially when I'm at work, I can't act like that. And I know I can't act like that, but sometimes it comes out anyways. So now it's affecting my work. I am in therapy. I'm learning skills. I also started an antipsychotic. I'm on an antidepressant. So trying to let those kind of start working and see how that goes. But it's a lot. It's a lot. So that's why I kind of created this channel. And, I want to bring awareness to people that are suffering like this. Because it's hard. It's hard. And people that don't have these diagnoses kind of look at it and think, I just don't understand why they can't pull it together. That's the biggest thing that I hear all the time. How come they can't just pull it together? They see themselves spiraling, do something about it. Exercise, or change your mentality, or this or that or whatever. Oh, when you have BPD, there's actual changes in your brain that takes place. If you get an MRI, you'll see changes and differences in their brains. It's not something that we have control over, and that is why we're suffering. And also, when we're committed to treatment for forever, it's, especially with all my other complex issues, it's, I'll be committed to maintaining a healthy mentality forever. And that's okay. But it's going to be hard. It's not going to be easy. And it's going to require support. and my support system is going to need support. Like, it's a big thing. So thank you guys for listening, staying tuned. I actually really like this furniture set now, especially when I can like put my feet up like this. It's getting kind of cloudy and windy. I think a storm is coming, which is the exact purpose for my little bistro set. So I'm going to sit here and enjoy the storm and just try and clear my mind, maybe meditate a little bit, do some deep breathing with some fresh air before I go pick up my son from my mother-in-law's. And yeah, I'll see you guys in the next video. Thanks.